All right, we're going live on Facebook now first, and then I will click broadcast in just a few moments or a minute.
Oh, there I see it says live on Facebook. That's cool.
Yep. Yeah, so we just went live on there. Okay. All right, and then I will go on this back. All righty, good afternoon, everyone. Thank you for joining us here on Monday the 18th for our Chamber Chat series. My name is PJ Prunty. I am the President and CEO of the Greater Danbury Chamber of Commerce, and I am very happy to be joined by Cynthia Emiry. Cynthia is the President and CEO of Regional Hospice. Cynthia, thank you for taking time out of your day. Appreciate it. How are things with you and your family?
Thanks, PJ. They're doing well. Everybody's managing just fine.
Excellent. I'm very glad to hear that. So let's hop right into it. Before I actually get into the questions, I would say for those listening, if you want to submit a question through the chat box, we encourage you to do so. We'd love to hear from you. Any questions you might have for Cynthia, feel free to send our way. So let's talk about what have been the top 3 impacts COVID-19 has had with you and the team at Regional Hospice.
Well, it has been an unbelievable situation that we've all been going through. You can plan the best you can for anything like this kind of thing, but really your plans kind of go out the window because, no one could have ever suspected it would be, what it has become. We have over 200 employees here at Regional Hospice, so we're a lot bigger, I think, than probably people realize. We take care of patients both in the center for comfort care and healing at Exit 2, as well as patients in the community in their homes. So we cover, full gamut of locations. So probably for us, hands down, the biggest challenge has been safety, making sure our employees are safe, making sure that when they go into patients' homes that they don't know what the patients or their family members have been exposed to, and making sure that they have the materials and supplies that they need to make sure that they're safe. Because, the end of the day, all you've got is your employees, and you want to make sure that they're kept safe. And that has been what keeps me up at night, frankly. Yeah. For sure.
Right.
So that's my number 1. My number 2 certainly is we are an organization primarily of caregivers. So we're a lot of women work here. 98.9% of our employee force is women. So we're also a lot of female head of households.
Sure.
So in that, it's women who are, got kids at home. They've got to figure out how their kids are going to be schooled, how they're going to be taken care of while they're here working or seeing patients. So certainly making sure our families of our employees are safe and that the kids have somewhere to go where they have childcare so they can work is a huge challenge for us. We have an amazing staff, and they've come together and really come up with really creative ways to help each other out. So we've been really lucky, but I know it's a big challenge for not only dual families, but also single head of household families too.
Yeah, you bring up a good point about that, sort of the ripple effect that you don't necessarily think of with the individuals going to work, that there's so many other concerns back at home that they have to deal with. And we were actually chatting about that before we started our call about balancing the family work life during these new times. So at Regional Hospice, you deal with loss and grief. What would you say to our listeners about how to cope with loss, not just of loved ones that might have passed because of COVID-19, but also the loss of what normal life used to be?
Well, I have a lot to say about that because I think people automatically think that you can't have grief unless you've had somebody that's died. That's a big misnomer. Grief is, I can't see my mom anymore because she, can't come out of her house. Grief is, I can't see my colleagues. Like we are all seeing each other looking like this, Here in the office, we can't even have a conversation without being masked. There's a form of grief. We can't go out for a drink with each other after work. Not being able to have the normal schedule that you have. All of that is a form of grief. And I think people don't realize that when you start taking away quickly or slowly all those pieces of your life that are relatively normal, And you now go from having to be at home and, all the things that go into, what's happened in this pandemic, that's a form of grief. It's normal, normal, normal to be sad, depressed, anxious, um, feel nervous about going out. All of those feelings are totally normal. And it's okay for people to be, to allow that to come through and not feel guilty that maybe because they didn't lose a loved one, they have a sense of grief. That's totally okay. I think is what you do with that grief that really is important.
That's a great point. I appreciate that. You just talked about the masks and the PPE, and I know that we were chatting several weeks ago about getting access to that, and know
Mhm.
that there certainly has been some challenges. Can you shine some light into how this process has been going? Again, both with the challenges and any potential successes that you guys may have had in obtaining PPE for you and your team.
Yeah. As a business, I would say that we thought we were really well prepared. We always have our medical supply chain in order because we, have to take care of patients. So we have to have supplies. We actually tried to order in advance and were unable to get supplies well before the pandemic was well known. And so we started sort of thinking that was kind of kooky and strange. Like, why couldn't we get stuff? Um, it has been, if there's any one thing we have to learn, not only as healthcare providers, but also as business owners and business leaders, is that we have got to have better supply chain management. There's no doubt, that is one of the biggest issues, both on a community level, but also on a state level. I have been amazed by what I've seen in terms of people coming out and supplying and donating to us. Like, people leave us stuff in our vestibule all the time. We've learned how to make our own sanitizer. Who knew that we could make our own sanitizer? And we've had to come up with really creative and innovative ways to take care of our own. Having said that, it definitely has been the things that keep me up at night that have been nightmare situations in terms of having to order supplies internationally. We've had to go to China, we've had to go outside of Connecticut to order supplies, and get really creative about how we've done the supplies. We've worked with other organizations in terms of combining orders so that if somebody wanted to do a million piece order, we don't need a million pieces, but maybe 4 other businesses do. So we've done some of that. Unfortunately, a lot of the supply chains are for DME are in China. So certainly we've had to order directly from China for some of those things. But I think that this experience will teach us a lot about what we need to do differently as a state and as a nation in terms of the national supply chain and how we handle illness. Because I don't think this is going away.
Right.
We're in this for the long haul. I mean, I think it's a good year and a half that we're in this, in different varying degrees. But when you look at when the flu season comes and cold season in the fall, it's going to be, another issue that we're going to have to deal with.
Yeah, absolutely. I couldn't agree more with you on that one. Again, for those that are joining us, you're welcome to submit a question through the chat feature. We'd love to hear from you. So it's located right down at the bottom of your screen for the attendees. So last year, Cynthia, you were named the Maricostas Entrepreneur of the Year from Western Connecticut State University, a very well-deserved award, and it was actually a great event. It was a really, really awesome conversation at the Ethan Allen. So what advice have you received throughout your career that you could provide to entrepreneurs in the area, or really, people in general, about, how can they navigate these unique and challenging times?
People probably aren't going to like this, but what I'm going to say is that having a pandemic has caused us to have to innovate differently. I mean, what business do you know that hasn't had to look at a completely new scrapped way to look at strategy and how you do business? So, from having to make our own sanitizer to having to find creative ways to get masks to even having sewing groups make our masks for us. Innovation and creativity, I think, is going to be one of the hallmarks of the silver lining of this situation. I've talked with a lot of different businesses through my YPO work that are doing things completely outside of healthcare. And it's interesting to hear how people are doing things differently, like how you can purchase a car by driving up, to the curb, and you're doing all this stuff online with how you want to get it's so funny to see those notes, how you want to get a car, and going able to buy it right at the curbside. Who would have thought you could get a car curbside, Well, Todd Ingersoll's doing that, doing all these creative and unusual ways of looking at, food. I mean, I'd love to be able to go out and eat dinner at a restaurant, but I mean, I've been able to try a lot more different restaurants. I've been doing a lot of takeout.
Right.
I think that it's going to be innovation and creativity and thinking outside the box. Telehealth is something that we're doing a lot more of in our work. We're doing a lot of telehealth. And I think telehealth is helpful in a lot of different reasons. If a person is at home and they're not quite sure they need to give a medication to their family member and they're a little nervous about giving it, they can just call us on a camera and we can show them exactly what the vial would look like, how to draw it up, how to do that medication administration. And it gives somebody a sense of confidence that maybe they didn't typically have because they would need somebody in front of them.
Sure. That's
So
good.
I think innovation, it's going to be all about innovation and creativity.
Excellent. Well said. Thank you very much. So yeah, we've got a couple folks who submitted some questions. Rob asked, how are caregivers able to say goodbye now? And what have you witnessed in this regard that has moved you?
This is a really difficult situation because this is where the grief piece really is raw, because not being able to say goodbye to somebody or be there when their loved one dies is, to me, a horrible situation. I mean, not anything I would ever want for any of the people we care for. In our center, patients' family members can be here with them. So people are not dying alone. And certainly I know that that is the rule in the other locations and the healthcare providers around here.
Yeah.
If the family member can come to the bedside and be there for that person's last hour of life, they're doing that. And I know we're doing that for the last few days. We are allowing visitors in our building. We also are allowing visitors outside, but we're very limited. We take temperatures and go through all of that kind of stuff. But I think the grief is going to be very raw. And I think that I say this all the time. You never forget that moment when your loved one dies. You want to be a beautiful moment, a sacred moment, and not being able to be there for some people is really difficult. And I think it makes grief more complicated. And I think getting through the grieving process is going to be more difficult for people who can't say goodbye. One of the things I want to say about that is that I talked about a little bit about the grief piece too, which is there are things that people can do to try to help move through their grief. And these are things I've recommended to people. If you're working at home and you're homebound and you can't, you're not going to the office, get up every morning and get dressed. Like literally get dressed like you're going to work, wear your work outfit, provide a sense of normalcy and an everyday structure to your life. Bring in the other things you might not normally have time to do, like meditation and exercise. And somebody said to me the other day, they couldn't get out to do exercise because they didn't want to go to the trails because the trails were crowded. All the gyms locally in Danbury are all doing live streaming of classes of, one-on-one. Do an exercise class. These are not things that are gonna diminish grief in any way, but they're gonna help provide structure so people can work through it, because you have to work through it. You can't get mired in the grief.
Yep, that's a great point. Senator Kushner is joining us, and she just said to say hello. And he's a source for face shields. So if you guys want to connect after the call about the need for face shields, looks like she'd be very happy to help. So thank you, Senator, for your comment and joining us. A council member from Danbury, Vinny DiGilio, he says you have always had a very large and committed volunteer base. I completely agree with you on that one, Vinny. How has that been impacted, the volunteer base?
Oh gosh, it's been awful in that we can't see them. Katia has been sending out emails to all of our volunteers, like video snippets to them, everybody around the office, but they haven't been able to come into the center. We can't even have gardening volunteers in our center. So we've been without our whole volunteer core. Many of our volunteers are calling patients in the community and checking in on them. And some have even volunteered to do grocery shopping, which is great, so that they're taking the groceries and delivering it right to the door. And that has been a huge help for some of our patients who don't have family members who can do that for them. But it really has impacted us. We miss not only seeing them, but they also offer a sense of support that's unique and different from what our paid employees do. So it's really, we're missing them terribly. And we're hoping that possibly in the next 6 to 8 weeks, we can bring back a few at a time and juggle that. But we've also had to make accommodations to our center facility. Like we've had to glass in our nursing stations, and we're working on glassing in our lobby so that we can create a protectionary measure for the volunteers and for the staff too.
Excellent. So you touched upon this a little bit earlier, that you're envisioning some of these changes in innovative ways being here for a year and a half, potentially longer. What other changes do you potentially see, either in sort of long lasting, year and a half, or potentially permanently at regional hospitals?
You and I talked about it a little bit before we were on the call, and that is events. We are an organization that has a lot of events for a lot of reasons. It's not just about fundraising. one of the most important things about our events is advocacy and getting people to understand that hospice isn't a scary thing and it's not about death and dying. It's about living fully until you pass. So having an event is really an important thing for people to get together. And that is a huge loss for us, is not being able to have an event. So our June gala is moved to September 26th, and we're going to have a virtual performance of some sort online where anybody can partake in it. Ming Tsai, who many people know is a very well-known chef, has offered to do a cooking class for us for as an auction item. So you can do a Zoom cooking class of Ming, which I think is pretty cool. So we were trying to think of course, innovative and creative ways in which we can raise money, because as a nonprofit, of course, fundraising is a big part of what we do. But also, how do you do it in an environment where you can't have people together? So that's a big piece of it. Our build out for our big children's wing, which was supposed to start at the end of the year, called the North Star Pavilion. We are going to be the one of only 5 children's hospices in the country, and the only one in the Northeast. And that 18,000 square foot build out was supposed to start sometime around November and December. We're predicting that's probably going to be moved until the spring or summer of next year. I certainly don't want to cancel that. Children are still dying, regardless of whether COVID exists or COVID doesn't exist. We still have terminally ill kids, and we need to have our children's and our babies' wing for them. So hopefully we'll be able to do that next summer, but not having an event limits our ability to raise funds. So we've done an online fundraiser for PPE, which raised over $100,000, which is wonderful. And people are so giving, even those people that give the $10, the $25 donations, all of those donations make a difference. So we're so appreciative to people doing that and leaving, things for us in the vestibule here as a donation. I think is we get 2,000 visitors a month to regional hospitals, which is a lot. From an economic development perspective, we provide a lot of service to the city of Danbury.
Sure.
A lot of those visitors come from out of state, and they come here to visit their loved ones, or they may stay across the street at the Hotel Zero. And we've gone from having 2,000 visitors to less than 50 because, of course, we can't have the regular visitor flow we've had. So what I worry about certainly is the economic impact that is on the city and how we're going to, diminish the restaurant usage and all of that. So I think it's important as Danburyans that we get together and we continue to use our services, buy local, use the services of the community. Yesterday, I ordered from Hallis Farm Stand, my first, produce delivery. This is how we're going to change as a community and supporting each other. And I think there's going to be a lot of good that comes out of this really horrible experience. There is. And one of the things I get the benefit of is being able to sit at the bedside of people when they're dying and hear from them what they would have done differently. Sure. What we as a community are learning from each other is, okay, we're now dealing with a pandemic of dying people, friends, loved ones. How are we going to change as a community and change the way we live? Because right. I think that's an important part of it.
Yeah, absolutely. And 2 things. One, Mike Hallis is actually going to be on the show series Wednesday. So we'll be interviewing Mike in just a couple of days. You actually just alluded to something that I've been chatting with my family and friends, and the fact that, illness and diseases and other viruses, that existed pre-COVID-19 are still very much apparent, right? And cancer didn't just decide to push the pause button to allow us to put our time, energy, and resources towards COVID-19. And that means people like your staff at Regional Hospice have to continue to do what they do and be at the at the bedside and give attention and care to those patients. So it's not really a question per se. It's more of I want to give you and your team a real kudos and appreciation for all the work that you're doing. And I guess you mentioned them earlier in your comments, but also another opportunity for you to tell.
Yeah, I have. I'm really blessed. We have like an incredible team here, and you often see in things, when bad things happen, right? You see that the good things that will kind of percolate from it. And one of the things we've seen a lot of is some natural leadership amongst team members and staff members, and having to reshift roles. I mean, some of our employees have been in different roles, have had to reshift into completely different roles temporarily to fill in areas of gaps that we needed. Being able to support each other during this time, both online, but also just through FaceTime calls so we can see each other is important. I have a really amazing team. We're an essential work environment, so nothing changes for us, right? The only difference is that our finance excuse me, our finance and some of our other administrative staff worked from home. For the most part, it's work as usual for us because patients still have to be seen in the community. Patients' needs don't go away. And it's even more complicated because a lot of physicians' offices have been closed. So when physicians' offices have been closed, the need still exists. And yet, how do you meet that need so that patients, their care is being attended to? So hopefully as physician offices will open up and the medical community will continue to start doing regular surgeries and other things that have been put on hold, people will be able to get the services and support they need.
Sure, I appreciate that. So last week you joined us as an attendee when I was chatting with Tony Rizzo, and I posed the question to him: what is he missing most about sort of the normal life that we had, pre-COVID? And I'll pose that same question to you, not to put you on the spot there, but
No, it's
what have
good.
you been missing the most?
Oh gosh. I think probably I'm missing the most going out to dinner.
Yeah,
And I miss going out with my colleagues. We go across the street for a glass of wine at the end of the day. I miss spending time with them outside of work. We miss just being able to spend time with each other. And I really, I think that's probably, my kids are going to be seniors in high school. And so this is a huge challenge for them. They're
sure.
going into their senior year at Immaculate. And I have to say, I'm going to do a shout out to Immaculate because they've done a fabulous job. I mean, a really fabulous job going online. But for kids who are seniors who are looking at colleges and not being able to go on college tours with my kids have been a little strange and doing everything like, virtually.
Sure.
But I'd say going out to dinner. I mean, at the end of the day, I'm just happy that we all are healthy and that, the people around us continue to be healthy. My employees are healthy. That is, again, what I said keeps me up at night, making sure that people stay healthy and protecting each other. And I think that, I just miss it being, our regular, work day without having to be in masks too,
Sure.
because it's really hot being in a mask all day.
Yep. That's very well said.
Mhm.
So that's all the questions that we had and that I had made up over the past couple of days. Anything else that you'd like to add to the conversation before we
Yeah.
end
Yeah,
today?
I'm going to offer a couple 2 cents. So I have a couple of things I think are helpful as people look through this whole grief process. One, we are doing a COVID support group so that if there's people who've had a loss that need a COVID support group, it's free. It's going to be a Zoom so people can tune into it. So I want to offer that. I also want to offer a couple of ideas that people think about outside the box, and that is meditation. I think meditation is a huge form of just stepping back and just offering some quietness to yourself and some self-reflection. I think meditation can really help when people are anxious. I'm seeing a lot of people who are really anxious and are having, just carrying it around with them. I would recommend meditation and exercise and some of the typical things that, people would say you should do, but really do it because it does make a difference. And then, do those FaceTime calls with your friends and loved ones, connect with people, reach out, get some books online. This is an opportunity to really do some self-reflection and really, tune into where you feel your fear is coming from, because there's so much fear. We have to kind of bring it down and address it, because once you address it, you start to manage it and you can be on top of it. So those are some of my pearly words of wisdom that I would say that I could offer to people. And this is going to be a tough road, and we just have to be positive and be thinking positively. The healthcare system, in our country has done an amazing job, and we've always valued our clinical staff, but now it's like, I'm so glad that everybody sees how wonderful they are and can acknowledge that.
Absolutely. Well, Cynthia, thank you so much again for taking time out today, as well as all the time that you're putting in with your entire team at Regional Hospice. We truly appreciate all the hard work that you and the whole team and the volunteers, as Vinny mentioned, do for our community. So thank you again. Really appreciate it.
And thank you to everybody who's supported us, and thank you, PJ, for doing this. It's a fabulous idea, and we really, we love hearing from our community people and our volunteers, and please keep sending the messages because it's really helpful and keeps us going. So thank you for that.
Absolutely. And a quick shout out to the Chamber's Communications Director, Amelia. She's been helping me get some of this information out and keep all of the businesses and members up to date on daily changes. As mentioned, Wednesday, we will be hosting Mike Hallis from Hallis Farms on Chamber Chat, and then we'll go a little bit down the road to chat with our buddy Doug Palestiner from the Amber Room on this Friday. So we'll see how he is doing in the hospitality industry as they gear up. Thank you everyone for joining us. Appreciate you taking time. Stay healthy and stay safe. Thank you.
Thank you. Bye. Have a good day.
You too, Cynthia. Thank you.
Thank you.